My case is also because I always proved the experts wrong. My impossible became possible.
Yes.
You see, so...
And through your pain, you find your purpose.
That's it.
What up, what up, what up? East Coast, West Coast, North, South, worldwide, YouTube family, Sickle Cell Warriors family. Welcome to another episode of Our Sickle Life. My name is Ulysses. Thank you for tuning in. Today I have a very special guest, Elvie Ingoli.
Yes, sir.
I got it. Elvie Ingoli, welcome to Our Sickle Life. Thank you for being here.
Thank you.
Today we are at the Sickle Cell conference in Montreal. Put it together by the Canadian Sickle Cell Disease Association of Canada. I'm very happy and pleased and blessed to be with this beautiful woman here today. She's going to tell us a little bit about herself, her story, her life journey. It's amazing, and can't wait you guys to hear this story. Hi, Elvie. Welcome again. How you doing? Tell us a little bit about you. Who you are, where you're from, your relationship with sickle cell.
Thank you, Lucy, for having me today. Well, I'm Elvie. I'm 38 years old. I was born and raised in Germany. Originally, I'm from the Democratic Republic of Congo. And I was born in a family of 11 kids. Different mothers, but I was the first sickle cell case in my family with the same mother. So we are 4, and I was born with HBSS, and
so
my
sickle
disease,
cell SS.
Yes,
right?
sickle cell SS.
So you were saying in your family there's 4 of you. You have 4 siblings.
Yes,
and
3 siblings. We are 4.
Okay.
And with the same mother, yes, with the same mother, and it's me and my brother who were born with sickle cell disease.
Okay.
So I'm the firstborn, and after me, my sister, she has the sickle cell trait, and after her, it's my brother, my little brother. He was born with sickle cell disease, also HBSS, and the last one, the little sister, she's AA. Yeah. So
3 girls, 1 boy.
Yes.
Right.
Exactly.
So you were born with sickle cell. So growing up, how was that for you? How was your experience living with sickle cell?
As far as I remember, it was hard. The childhood was hard because I was always in the hospital. So my sickle cell disease went very, very, very bad. It affected my organs, so my lungs, and it was between death and life. So being born in the 80s, where there was no treatment or nobody knew about sickle cell disease in the country I was born in Germany, the treatment was really bad. So they just treated the symptoms. And because the disease affected my organs, I was almost dead. So they had to find a solution for me. So the doctor who did the diagnosis of the sickle cell disease, in my case, sent me to Brussels, so our neighbor country, Belgium. Belgium, yeah, the capital of Brussels, because there was a clinical trial or study for the cure of sickle cell disease by a bone marrow transplantation.
Okay.
Yes. So I had to undergo this trial because otherwise I wouldn't make it to my 6th birthday.
So you were 5 years old and you were going to a lot of sickle cell crisis.
Yeah.
And so then they sent you to another hospital. Sorry guys.
Yeah.
Jeez. All right.
I was born with sickle cell disease, HBSS, and in a country like Germany, where they never heard about this disease, and the treatment was really bad, from the beginning on. And the disease, I had a big organic damage from this disease from the lower age.
Okay.
So, which
What organ was affected?
the lungs.
The lungs.
Yeah, the lungs. So, because there was no treatment for me except of penicillin, I underwent a bone marrow transplantation as a clinical trial. So, this is why I am the first patient of Germany who got cured from the sickle cell disease 30 years ago. So, at age of 7.
Nice.
Yes. So, yes, it was a good experience for me that I survived sickle cell disease and became sickle cell free. I will explain to you why I say sickle cell free. Because I was able to live a normal childhood, what I always wanted as a young girl, because I lived in the hospital. I was always in the hospital. Yes.
I wanted to, so you had your bone marrow transplant at the age of 6? Is that
Yes,
correct?
I went to the hospital in this trial at the age of 5 and came out at the age of 7.
Okay.
Yeah.
So
So, I
you
spent
went in
almost
that
2 years in the
2 years.
hospital.
Okay.
Yeah.
So you were in Germany. Your doctor that diagnosed you
Yeah.
sent you to Belgium
Yes.
for the clinical trial to do the bone marrow
It
transplant.
was in Brussels, on the capital from Belgium. Yes.
And at the time, bone marrow transplant wasn't like current like they're doing it now.
No.
It was like very like early in the
Yes.
in the time.
Yes. Mhm.
And you were probably the first patient that did
Yes.
it, right?
Yes. Yes.
And
It was a trial. Yeah.
so you spent 2 years in the hospital.
Yeah. Almost 2 years.
And do you remember your experience when you were young, like in the
Yes,
hospital?
very well. Like I said, my childhood.
Those 2 years, how was that for you? Those 2 years in the hospital going
Well,
to
I
the
think I
transplant?
didn't really understand what they are doing with me. You know, also the lack of education about the disease and everything, because they were so concentrated to treat the symptoms of sickle cell disease. And afterwards, they sent me to Belgium. And for me, it was like a routine, because I always spent my time in hospitals. So the most important thing for me was that I feel comfortable in the hospital, and I was used to that the teachers come and teach me in the hospital and everything. So I felt comfortable, especially because my mom was always on my side.
Okay.
Yes. And I was used to pains and everything, all these kind of treatments. And well, what I really remember is when I was clinical dead.
Oh wow.
Yes, I remember this moment. I was playing with my doll and everything. I even have a picture of it, of this moment.
Okay.
Because when I was in isolation, my mom used to take pictures of me, how I was playing myself with my dolls and everything. And I remember this moment when I really went dead. Is I was playing with my doll, and then directly I saw black. So everything turned black around me, and then I fell on my back on my bed. And yeah, when they explained to me later, they had to bring me back and everything. It was all
So
the
your heart actually stopped?
Yes. So it was all the reaction of this transplant and the cells and everything. My donor was my sister. That's my sister who has the sickle cell trait, and it was
a full
100% full match.
Full match? Okay.
Yes, it was a full match. So, which meant that the BMT was successful lately after 2 years, and I became sickle cell free and started a new life. And yeah.
So when you say sickle cell free, does that mean like after you did the bone marrow, like growing up, like did you stop having pain?
Yes, as far as I remember, I stopped having pains, and I know I was taking medicines constantly after the treatment.
That's for to prevent you from rejecting the transplantation.
I bet so. I can't really explain, because even if I ask my parents, they don't even remember, especially because the main caregiver was my mom. you know. And I grew up normally. I started playing basketball at the age of 7 directly. And the sport gave me the self-esteem what I needed. Yeah, that's why I went really almost professional with basketball. And 7 years after this BMT, I was diagnosed with bone cancer.
At 14?
At 14, yeah, almost 14. So I was 13 and a half. It was in July 1998. I remember the moment because, yes, it was the moment where I wanted to go professional with basketball, and I was teared up from this reality again by a disease. I grew up in a big family with many siblings, and it was just me who was always sick. And I never understand it because I grew up as a very shy introvert girl, because everything that I underwent, it traumatized me. So every time if I was sick, I asked myself why me again. So when the cancer came in my life in 1998, I didn't understand from where is it coming from and why, because it was like the BMT or the sickle cell disease was almost recently, you know, even with, it was just 7 years ago, but it was me again going to...
And what kind of cancer did you have, and what was that?
Bone cancer, so-called osteosarcoma, in my leg, my right leg. And normally, the doctors try to figure out if it's something in the family, or if we have it in the family, but there was nobody in the family who had this kind of cancer. So they treated it like, normally. And I said, okay, after 9 months, if this chemotherapy is successful, you will be done with the disease. But in my case, it wasn't the case. So I spent another 2 years in the hospital with this disease, with the bone cancer. And they removed the tumor from my leg and put a artificial knee in my leg. But 2 weeks after this surgery, my body rejected this artificial knee. This is where the suffering started. So during the 2 years, I had 10 surgeries. And
10 surgeries?
10 surgeries in the same leg. And they try to figure out how they can manage it or keep the leg without doing amputee. So 2 years later, I won the fight of cancer, and but the past disability I had with the sickle cell disease, what I always say, sickle cell disease, it's a non-visible disease. My disability became visible by all the surgeries I had with the cancer. So they fixed my knee. I couldn't walk properly anymore. So I couldn't play basketball anymore. I was physical and visible disabled. And this was in my teenage. So there was another
in your
thing
teenage years, you had to face this, going through this battle.
Yes.
And being alone again, because you're the only one that has it. And in terms of going to the surgeries, being in the hospital for a long period of time, how did that affect you? On a personal level, emotional level, how did you feel? Did you have a good support system to help you go through that?
Well, I always say the best support a patient can have is from the family. The family and the surroundings, friends and everything. And I really feel lucky that I had this since day one. So my family always supported me, even if I asked myself why it's only me. But the love of my family gave me the motivation to keep on going and to don't give up. And the support from the family. And of course, in a country like Germany, you have a good support system. Especially, what is more recent in my case is the cancer. I was a teenage when I suffered from cancer, you know, and the support system is well established for cancer patients, so I can't complain.
Yeah.
So all my wishes.
So you had the resources to help you to go through that.
Yes, of course.
Okay.
Of course. So I survived cancer. So that's why after surviving cancer, I was able, to go towards a very good adulthood, if I can say.
Yeah.
And I accepted my disability.
What do you mean by that? Like
Yeah.
you accepted it. What do you mean by that?
I accepted it because when I got the diagnosis, I wanted a basketball career. So with the diagnosis, they told me, okay, after the surgery, you won't be able to play basketball anymore. Maybe with the Paralympics. When I heard this, I was 13. I said, are you serious? And directly I went into a depression. I was really sad about this. Really sad because I wanted a normal life. Since I can think for myself since a child, even with the sickle cell disease, I wanted a normal life. I wanted a normal childhood. And when I became sickle cell free, I just wanted to be a normal girl, like all my friends. And now the doctors tell me again, okay, you can't play basketball. And basketball was really important for me because this is where I was able to be Elvie myself and escape many problems.
I wanted to ask you, what do you mean by I wanted to be normal? What does that mean to you?
Yeah, normal, because when I saw my siblings, you know, not experiencing the same struggles like me, I knew that I wasn't normal. I've always thought
Yeah, but
kids
can you explain that to people that they're watching this and they don't understand what you mean by that? I understand what you mean by that because I have sickle cell and I know what it means. But for people that don't understand, like, what does it mean when we say, like, you know, we wanted to be normal, we wanted to have a normal life?
Yeah.
What does that mean?
From my point of view is being able to do what you want to do, being able to decide what you want to do and when you want to do it. You don't want a certain force, like a disease, taking you out of what you are about to do. You know, you don't want always be sick and always be in hospital and always being seen differently, because when people looked at me, I saw this, they're pitying me, you know, and I really feel uncomfortable with this view, seeing people pitying me because I'm suffering, I'm crying and everything. And of course, my physique was different. You know, I'm a girl. Growing up with a girl, if you have a role model and everything, every girl has a role model. And if I watch myself in front of a mirror and I said, okay, I'm skinny, more skinny, and my legs are different, and
So you're looking at different aspects of characteristic of your figure and you're comparing it to other people. And you're looking at yourself and that kind of take a hit on your
And I asked myself, because if I saw my sisters, they weren't like me, and I asked myself, okay, I'm like this because of this disease, so this is not normal. This is what I'm explaining from a point of view of a little girl.
I understand
when I was suffering with this disease.
But I'm going to give an example. Like, you know, for me, like, I have a port, right? So I'm skinny, so the port kind of protrude out. So it doesn't look good, you know what I mean? It doesn't feel good to look at yourself and you see the bump there, like, right? But come to a point, like, I accepted it, I'm okay. But in the beginning, it was a challenge. And the same thing, like, you know, not able to gain weight, you know what I mean? It's like everybody's like bigger, stronger. Like, when I was growing up, it's like I really, like, you know, started to grow like around 16, 17 years old. That's when I grew up. In one summer, I just grew up, but I was really short. And then I grew up in one summer, and then I thought to myself, like, you know, I thought this day would never come. Like, you know, I was always short, and I was like, everybody around me was getting taller, getting bigger, getting beard, getting everything, and I had delayed growth on everything. So I understand where you're coming from.
Same as me.
And, you know, so it's like, as a woman, like, you know, I have like other women that have sickle cell that would say, like, you know, they would like to go to the beach, like, you know, wear a bikini or something like that, but, you know, they feel self-conscious about their scars or things like that. But it got to a point where you start to embracing your scar, because your scar, like you said,
this is coming.
You know,
Yeah.
So, so that's why I wanted to kind of, if you can elaborate on that. So that was good. Yeah. And so when did you like came to terms with, like, you know, okay, this is what's going on, this is what I have, but I'm gonna fight it. This is not gonna beat me. I'm not gonna give up. Like, where did you get that mentality, that attitude to face it, like, you know, forward and say, like, you know what, I'm not gonna give up? Where does that strength come from?
Yes, a very good question, because when I was a teenage, I forgot about my sickle cell disease. Of course, because I was done with this, and for me it was done. And we never talked about this again. But I have two further brothers who are suffering from sickle cell disease. So all I know is when he was feeling bad, it affected me. So when he was at the point that, okay, he also needs a BMT, but he was already an adult. He was 23 years old, my brother. He needs a BMT because he really suffered with the sickle cell disease, and I was already 10 years older. I wanted to help him, be there for him, care for him and everything. And I was really afraid about this BMT, but I said, okay, in my case it succeeded. He will be fine as well. He will survive this BMT, and he will become sickle cell free like me 30 years ago. And this was the case. He survived the BMT, he became sickle cell free, and
who gave him the transplant?
it was also the sister.
The same sister?
Sibling. No, not the same sister. The last one.
Okay.
Who was AA.
Okay.
Mine was a sister who has the trait.
Okay.
Yeah. So this way to the BMT, this is where I got more involved with the subject sickle cell disease, what it means, and I found our advocacy group from Germany, because the medical advisor from this group is the one who did the diagnosis, in my case 30 years ago. But we lost the contact after my BMT. I remembered her name because when I had the cancer, I ended up in the same hospital where I was when I had the sickle cell disease, suffering with sickle cell, so the same doctor. And when I was done with the cancer, I was gone again because I wanted a normal life. So party, traveling and everything, even with a disability. Yes, I did everything. I traveled everywhere and I just wanted to catch up what I was missing. So if you know Elvie, you know Elvie. She's always funny, smiling. She loves living and everything. I never set barriers in my case. So I did my driving license with my disability. I climbed a hill in St. Lucia and everything. So I had all the courage that I needed. So it will help me to catch up with everything. So we met again with this doctor when my brother was going to prepare his BMT. And she brought me to the advocacy group. She said, hey Elvie, where have you been all these years and everything? How are you doing? Are you aware that you were the first patient from Germany who got cured from the BMT, from the sickle cell disease? And I'm so happy to see you. What are you doing in life? I told her, okay, I did my A-levels. I went to university. I did a career, professional career, and now I'm a mother. And she said, oh yes, you have a child. And I said, yes, I have a child. And this is something that I forgot to mention because we're just talking. We're just talking. And
so let me pause you there.
Yeah.
So you mentioned that you are a mother, you have a child, you had a career. So what was your career? What did you study in? Because we kind of missed that. So from 17, so you went to university, college?
Yes.
Like, yeah.
Well, I wanted
Because
a basketball career.
So from the basketball career, you were fine at that time until you got the diagnosis with cancer.
Yes.
And that gave you a setback of 2 years?
Yes. In these 2 years, I learned to get rid about this idea to have a basketball career. I accepted my condition. I accepted what I'm going to be or how my future will be. I have a disability, a physical disability. Okay, what can I do? So, and I wanted never to depend from someone, either from my parents or a partner, whatever. At this time, I didn't have a boyfriend. I started everything late. And then I said, okay, education is the key. So I did my A-levels, and then I said, okay, where should I?
When you say you did your level?
A-levels, the graduation back.
Oh, baccalaureate?
Yeah, baccalaureate, yes. And then I said, okay, let me go.
But what
to
did you study?
university. Yes, I studied Diploma International Office Management in 3 languages. So English, French, and Spanish. And I knew that I would do my career, professional career in Germany, because however, I was always afraid to leave the country where I'm used to good care and everything, because I had to have my regular appointments, the orthopedics, and on this specific clinic or specific center where every year. So I had offers to go abroad in another country and everything, but I was a little bit afraid of it. So I said, oh no, I will stay in Germany because I have to.
You guys have free healthcare over there, right?
Yeah, the healthcare and everything. But I loved traveling and everything. I did all of that. And then I had my first boyfriend and everything, and I kept going.
How old were you when you had your first boyfriend?
I was 17.
17?
Yes, I was 17.
It wasn't that good.
Yeah. Yeah, I was 17. And yeah, and then at my earliest 20s, having a boyfriend and everything, you were talking about, okay, do you want a family, do you want kids and everything. So in my yearly checkups, the doctors told me, okay, you had BMT, you had cancer and everything. It might be difficult for you to have kids. And I said, okay, I don't even want to have kids. I want a career, I want a husband. I don't even want to get married. I want to be the best auntie for my nephews, my nieces and everything. And okay, this was in my earliest 20s. So
the doctor told you couldn't have kids, right?
Yeah, he told me it will be difficult, very difficult.
But I didn't say you could not have kids.
This came after,
Okay.
when I really had the wish to have a kid, and then we did tests, and it came out it's almost impossible.
Oh wow. Okay.
Yeah, and then he told me it's impossible. You had chemotherapy twice. They didn't freeze your sperms or whatever, and it's almost impossible. That's why you never got pregnant. And
so when you did the process of going to chemo and all that, they didn't freeze your eggs and do all the
not as far as I remember. I asked my parents
to
but
save those.
nothing. I asked my parents.
But I think now it's becoming a protocol that they're starting to do that.
Yeah, they asked my brother, for instance, because he got his BMT 6 years ago. They asked him, yes.
They asked him to
Yes. But in my case, no. So when the doctor told me that, after doing all this tests and everything, and I was mid of 20s, 25, 26, something like that, he told me, okay, it's impossible, and I said, okay, then I have to accept and just keep going, enjoying life and surviving life. And then one day I got pregnant, naturally, and I wasn't aware about this pregnancy. The doctor just found out of my pregnancy already in the 2nd month. And the same doctor who told me that it's impossible You have kids. It was the same doctor who used the word, "Oh, that's a miracle." He said, "You are pregnant. I don't know how you did this, but you are pregnant." And I said, "Wow, okay. Normally, yes. Normally." So I carried my first son 9 months. So I didn't have any miscarriages, because he also told me, okay, sickle cell patients have a high risk of miscarriages and everything else. And I always told him, hey, I don't have sickle cell disease anymore. But however, he always tried to explain it with the sickle cell disease, and said, okay, you just watch me doing my thing. I carried my first son 9 months, gave birth to him. And then he said, okay, maybe this was just a chance or a miracle. Maybe it's impossible for you to have a second pregnancy. And I said, okay, you should stop talking. Now I understand that I have to be a mother and I want more kids. So 15 months later, I gave birth to my second son.
Oh, wow.
Yes. Gave birth to my second son.
How old were you at that time?
30.
30?
Yes. So my
your
first
first
pregnancy
child?
at 29, yes, and the second child at 30. Yes. Yes, and then I paused and I said, okay, now I have 2 kids, 2 boys. So 7 years later, I wanted, because I have 2 boys, I said, okay, let's try and have another baby. Maybe it will be a girl. And it was twins. I was pregnant. I was pregnant with twins. And in the early stage of my pregnancy, I had a miscarriage of 1 twin. And 9 months later, I gave birth to my 3rd boy.
Okay.
So that's why I'm a mother of three
Also, you
boys.
lost one in the early stage, but the other one survived, the twins?
Yes, I was pregnant with twins, and I had a miscarriage in the early stage of 1 twin.
So one survived and one died?
Yeah.
Oh,
yeah.
wow.
Yeah.
That's amazing.
That's right. Yeah. So now
So you have
I have 3 boys.
Nice.
3 boys. Thank you. They're all in good health. They have the sickle cell trait because their father is AA.
Okay.
Yeah. And then I understand when I became a mother and my brother survived the BMT and I had my first experience with the sickle cell advocacy group, I understand who I am. And I understand that I shouldn't be ignorant about my sickle cell disease, because in this advocacy group I have been educated about the sickle cell disease. An education which I never received in my family or back in the days when I was suffering the sickle cell disease. I was never aware about what does sickle cell disease means, where does it come from, and all the information that I have now. I was never aware about this. So I always thought that, okay, I was cured by sickle cell disease, so I'm done with this. And when I understood that I am not done with sickle cell disease, this is where everything started. This is where I am now, which brought me or gave me the motivation to advocate.
So before we left, we were just talking about your purpose. You discover your purpose after going through all of that, and having sickle cell is still part of you. It's still in your family. You have a brother that has it, and you discovered your purpose, and now you are the president of the Sickle Cell organization in Germany. You're a patient advocate, and you're learning more about sickle cell than you ever done before. And now you are a voice on the global scale, the global stage, to talk about sickle cell advocates for sickle cell and change policies and change things so that the next generation of people living with sickle cell can have a better life than you did.
Yes.
Right? So if you can tell us a little bit about the past few years, like, had happened, and then so where you are from that time. Like, so we went from a pandemic in 2020. So from 2020 to 2023, like, how was your life? That's good.
Yeah, I had a new challenge because, I was already the president of the Sickle Cell Organization of Germany, advocating for patients and everything. I understood that I'm not done with sickle cell disease. I'm still a sickle cell warrior. I changed my wording, so I never used the word again, I'm cured from sickle cell disease. I rather say I am sickle cell free because my gene hasn't changed. And because I gave birth to kids who have the sickle cell trait, I understood that it's my responsibility to continue talking about sickle cell disease and to advocate for sickle cell disease. And even if I was in a stage of life, I am sickle cell free since 30 years. I am cancer free since 20 years because after my cure of 10 years after my cure of cancer, I received the information and the confirmation that the cancer was a side effect of the BMT.
Oh wow.
Yes. So it was definitely a side effect. So I'm also one of the first patients, sickle cell patient who got a BMT, and after the BMT, a cancer after side effect, as a side effect. So I survived all the two diseases, and when the pandemic started, I was already a mother of two kids, trying to do my mother duties, my wife duties, and everything, like every woman. But meanwhile ignoring my health, so my visible physical disability. I suffered a lot since I became a mother with my leg. I had many pains, I ignored the pains and everything. I became weaker in walking and everything, but I ignored my own problems because I wanted to do my wife and mom duties. So in 2020, the doctor saw that I have a new tumor after 20 years of my diagnosis. On the same leg?
Okay.
So a new tumor, and I had to check whether this tumor is cancer or not. And they checked it by 30 minutes surgery, and then they saw that it's not a bad tumor, so it's not cancer. They had to remove it. And in this surgery, I got an infection, staphylococcus. And this is where my suffering, my new suffering, and my third suffering in my life at age of 35 started again. But this time as a mother of two and a wife. And I said, okay, even after 20 years, I'm here again. Yes, I didn't understand why.
So God has a bigger purpose for you.
Yes.
You discovered through that experience, I guess.
Today I understand. I'm so grateful again for this experience, because I say everything I underwent, it made me stronger, gave me the self-esteem that I needed. And from 2020 until 2021, I had again more than 10 surgeries in my leg because of this infection. So
they had to redo the knee again?
Yes, because the surgery I had, or the last surgery I had during my cancer, they fixed my knee, and with a donor bone coming from the States.
Okay.
Yeah, and it wasn't my bone.
So they grafted a bone from a donor.
A donor,
Somebody
yes.
give you a bone, and
Yes.
then they put that in you.
Exactly.
And that was fine? That worked?
Yes, and this bone was in my leg for more than 20 years.
Okay.
And this bone got infected with staphylococcus.
Oh, wow.
Yes. So
they had to remove it?
Yes, they had to remove it. So my leg stayed empty during more than 4 years because they had to fight this infection and look for a new solution. What should they do now with the knee, with the leg? Because they remembered that the trying to give me an artificial knee, my body rejected it. So they said, okay, listen, Elvie, the easiest thing is to do an amputee. You know, there are a lot of prosthetic and everything. You can have a better life quality with prosthetic and everything. So you don't need to struggle like that. Come on, let's just
So the option
amputee.
they were giving you is to cut you
First, yeah, the first option was the amputee. And I said, listen, I don't have a problem with this. But this is something my parents didn't decide back then when I was suffering with cancer. I will never forget when my father said, he said, no, my daughter was born. My daughter was born with 2 legs, so you have to do everything so she can keep her leg. I don't want that amputee. This is what my father said 20 years ago when I was suffering. So, and I grew up with this disability. I did everything with this. My driving license, I climbed the hill, like I said, and I had 2 babies with this leg, so it was a part of me. So it was really difficult for me to decide, okay, now you can amputate. I said, no, I want to keep it. So it was a really intense concern for me. And I asked the doctor, okay, please try to find a solution. And at this time, the doctor wasn't able to find a solution. So I went to another hospital. It was the hospital who did the surgery to me 20 years ago. And the professor from this hospital, when he saw me 20 years later, he said, Elvie, where have you been all these years? You know, we're in 21st century, and the medical science has improved. So indeed, we can try to put you a new artificial knee there. A better one that we tried to put 20 years before. But we can just try. If your body will reject it again, then you have to know that we need to do the amputee. And I said, okay, I'm used to try it. So just do it. Try it.
As long as you have an option.
Yes.
Because
I had
the other
this
one,
option.
there was no option.
There was no option. He never gave me this option. He said, okay, it's best for you, don't struggle. And I said, no, I want an option. Yeah. And then they did this surgery. They put me a new artificial knee 23 years later, and this surgery succeeded. So a year after, I had to go to a rehabilitation center and learn walking again.
How was the process of recovery?
Yes, it was a long process because for 23 years I couldn't walk properly. I wasn't able to bend my knees. And 23 years later, now I can bend my knees, and I had to learn walking again. So I went to a rehabilitation center for 3 months, and I'm still in the process, of course, because it's already almost 2 years ago. But
you're still doing physio?
I'm doing physio, kinetics, everything, and you have to put a lot of patience for it. But during this progress and process, I got pregnant. Like I said, with my 3rd child, and this was a completely fulfillment for me. This is where I said, okay.
And you're here today, you're in Canada.
Yes.
You travel, you know what I mean? Yeah.
I'm almost 40, that's why I say my birthday is very special for me, because it's given me always the, showing me that giving up for me was never an option, and will never be an option, because I always came out stronger with all the things I experienced in life. It made me stronger. It gave me the self-esteem that I needed, and my body is full of scars. I can't even count how many surgeries I had, but I love every single scar of my body, because every single scar tells its own story. it tells the story what I went through, what today I have the courage to talk about, to empower another warrior. Yes, I am still a sickle cell disease warrior, and on top of that, I'm a cancer warrior.
Survivor.
Yes.
Yeah.
And today I say I'm a woman king because, what happened during this pandemic, you know, as a mother, you are being sick, you are afraid to lose your family, you are afraid to not making it and dying and leaving your kids and everything. But I always said, because I'm a Christian, and I always said that if I survive, it's also because, of God. The God in me are activated to go through all this and to give me this hope that I will make it, I will survive. And I told God when I was in hospital, and I said, you didn't give me kids so they will come without or be without orphans now. So there must be purpose. So bring me out of this hospital. Let me do my mother duties. I don't want my kids to see me like that. Okay, and I was afraid of losing my family, husband, and everything because of what I'm going through again, not being able to be at home but laying in bed in hospital.
Before we close, I just wanted to ask you a quick question. You know, being in a relationship with somebody that that has a disability or health concerns, whatever. How is that on the relationship between the couple, the relationship between families? Like, how is that for you? Like, going through that difficult time.
It's a very sensitive question, I have to admit, because it also depends on the different mentalities you have in a couple.
So I'm going to give you an example, and I'm going to use my personal story. My partner, she also has sickle cell, and our families, they didn't want us to be together because when I'm sick, she's sick. If we sick at the same time, it's difficult. It's very difficult, and if you don't have this family support, it makes it even harder, and it brings more strain into the relationship as a couple, and it's you don't have the same patience that you have when you're fine. When you're well, you have patience to go over to a lot of things. But when you're unwell, your patience wears thin, and you kind of you could be short with your partner. There's a lot of things that goes on that makes it even harder. But now when you look at, because your family will always be for you, will always be there to encourage you, will always be there to support you and elevate you. But that doesn't mean the other family will see things the same way. And sometimes they look at it he's sick again, you should let him go, that there's no need to be with somebody like that.
Yes.
I've heard a lot of stories like that. So, and experiencing it too, it's not easy, So it's how do you gather the strength to overcome those things, and where do you get your strength to still make it work despite everything?
It's all about the self-esteem. And I got the self-esteem after experiencing all I did, coming out stronger. And first of all, I looked at me as an individual. It's very important to see what you are able to do now, to see what kind of strength person you're a superhero. I call myself superhero, for real. Because I know that there's nobody out there who wants to walk in my shoes. Because when I tell my story to people, they say, oh my God, you're so strong. I would say I want to die. And I said, of course I had moments where I said, okay, please, especially when I had no kids. I said, okay, please, I'm tired. Take me. But it was never the case. I always came out safe. I survived all of this. And when I had kids, I said, no, I have to survive for my kids. So I had something where I said, I have to survive. And this made a woman out of me would say, okay, I'm able to overcome everything. I'm so strong. So this is what I also tell other patients and try to empower them. The moment you understand that you have to dominate your disease, your condition, this is the moment where you win. Don't let your condition, your disease dominate you if you want to survive this life. You have to dominate it.
And how do you do that?
How do you do this? How I did this, like I already gave you the example. When I was done with cancer and everything, I wanted to do everything. So I started traveling, climbing hills. There was no barriers for me, no limits for me. I started to feel myself. I said, I am beautiful. Even if people say, oh no, she's always sick, and I don't know. Sometimes it was like I thought that I'm not beautiful enough, or I'm not a woman enough. But this changed directly after overcoming all these challenges. I started feeling myself, and I said, no, I'm really beautiful. And this is what I showed. It came out the way I feel myself. And this is what started attracting men to love me. Say, okay, what I love about this woman is this, and that.
So the way you overcome that is by telling yourself that you have things to live for.
Yeah.
Telling yourself that you want to experience things in life like you were saying earlier, like normal. You want to be able to travel. You want to be able to see your kids grow. You want to be able, so you have expectation of your life to be a certain way, and you're doing whatever you can, whatever is in your power to make it happen. And you tap into the God in you to give you the strength to overcome those things and keep pushing and keep going forward.
Yeah, because I realized I'm still here. I should have died at the age of 5. I didn't die. I should have died at the age of 13. I didn't die. I should have died at the age of 35. When I had the new tumor, I didn't die. I'm still here. So there must be a purpose. So I can't take it for granted. You know? So that's why I said, no, I am woman enough.
But the other thing too is like when you go through those things, those kind of experiences, it makes you realize and it makes you appreciate life on a deeper level, where something simple as I couldn't do this before surgery, tie my shoes. Now tying my shoes, it's a joy because I remember I couldn't do it. So now it's like going to do this, it's like I don't look at it as a chore, I look at it as something like, yo, there was a time I couldn't do that. So it's like those little moments, like when you go back in time and think about the struggle, and to the struggle, that's why you carry your strength.
Yeah, in my case it's also because I always proved the experts wrong. My impossible became possible.
Yes.
You see, so...
And through your pain, you find your purpose.
That's it. And that's why I have the self-esteem what I need. And I want to live a long life, because at the end of the day, I always wanted to survive. I always wanted to live. I love life. This is what my name says as well, Elvie. Yes. She lives.
Like that.
She lives. She has to live. And this is also the reason why I'm advocating for patients. I want to be the patient voice, and I am the patient representative to support them who are not able or not ready yet to advocate for themselves, to talk for themselves, because I understand, you know, because I came from there.
Yeah, you are a living miracle. So,
I know about this.
Living miracle.
I know about this.
Well, I wanted to thank you for taking the time.
Thank you.
It's a pleasure. I love hearing your story. I hope that, you know, this story give you guys some perspective, help you guys, you know, gain strength, and remember one thing, never give up.
It's not an option.
Yes.
We're warriors.
All right. So on that note, thank you. Tuning in for the next episode. Peace, guys.